Hi, I'm Dr. Navdeep Panu, a medical director from TMC Fertility and Women's Specialist Center, Malaysia. I'd like to thank you all for inviting me to give a talk in the Aspire 2022. Today, I'll be talking to you about strategies encompassing novel endometrial status testing solutions. In the recent years, advances in artificial reproductive techniques have increased the overall success rates of IVF treatment cycles. But unfortunately, still there are significant number of cases that do experience repeated implantation failure for some reason or another. There are multiple reasons, but somehow after all these years, we still can't get it 100% perfect. So when you come to recurrent implantation failures, the definition is debatable. Okay, you can have some people take it as 2 or 3 unsuccessful cycles as recurrent implantation failure. Some even take one, after which then they start doing all sorts of things, but generally it's 2 to 3. There are many contributing factors: infection, the womb lining, fibroids, or irregular womb lining due to polyps, when genetic causes where the embryos are unhealthy, and nowadays been talking a lot of things that a lot of discussion rather about endometrial receptivity. So this has been quoted from one of the articles where fertility in humans depend absolutely on the synchronous events that render the developing blastocyst and the receiving uterus competent for implantation, right? So endometrial receptivity is defined as the period during which the endometrial epithelium acquires functional but transient ovarian steroid-dependent status supportive to blastocyst acceptance and implantation. So somehow this may be one of the holy grails for improving our pregnancy rates. The endometrial receptivity is something which, if we can get it right, then I'm sure lots of patients will definitely benefit from this. So they talk about lots about window of implantation, the specific time span in which the endometrium is receptive. Okay, it's also known as the window of implantation. So the blastocyst implantation occurs during a very tightly controlled interval, which is usually between the 16th to 22nd day of a 28-day menstrual cycle. But then again, for IVF, we can't seem to use that. So what we generally do is, it normally appears 7 days after the LH surge or the HCG administration during a natural IVF cycle for frozen transfer, or 5 days of progesterone administration. Generally, what we do is, we 5 days is equivalent to 120 hours in a HRT cycle. So regarding this endometrial receptivity testing, so one thing that they've come up with is the microRNAs. It was first discovered in 1993, about 18 to 25 nucleotide long non-coding RNAs. They're involved in gene regulation as found in humans and other multicellular organisms. There are more than 2,500 discovered in human genome. And they do play a very, very important role in our reproductive cycles and systems. So these microRNAs regulate the expression of the genes involved in the establishment of the window of implantation. So if we have a dysregulation of it, then that may cause failure of implantation. There are certain studies that have been published, and one study from Fertility and Sterility that was published in 2021, it was last year, fairly recent. This study said that they had 90.9% prediction accuracy of the final 3 microRNAs that were tested. Initially, they tested quite a number, then went down to 6, and then they settled down to 3 microRNAs. Now, they found that most of the patients eventually had receptive, or rather they got pregnant if they had regulated a normal these 3 microRNAs. So there are few types of endometrial receptivity analysis in the market nowadays. One is the mRNA-based, and MIRA is the microRNA-based. Okay, the good thing about MIRA is that the amount of tissue that's required is much lesser. The turnaround times is faster, and the RNA quality is good, stable. And the other thing, as clinicians, what's important to us is that the failure rate means that the chances of which the patient needs to repeat the test. Now, if you ask the patient to repeat any test for that matter, okay, and you claim that the results were not accurate or something was not wrong, then they won't be very convinced that this thing really works, right? So certain type of systems are more than 5% failure rate. However, in MIRA, it's only 1%. So that, as a clinician, is reassuring for me. Okay, so as I said, what are microRNAs? They are master regulators in the human body, regulating about 60% of the mRNA's expression in the body. And the main advantage, as I mentioned, it's very stable and not easily degraded. So in this novel situation for endometrial status testing, this mRNA-based testing has a lower failure rate, less than 1%. The biopsy technique is similar where we use the Pipel sampler where we scrape the endometrial tissue, but they require lesser sample. So it's much faster and a faster turnaround time. This is the sample report. It's quite detailed. You can see that they will tell you exactly when's the best time to place the embryo back into the womb. Okay, so this result indicates that day 5, which is 120 hours, plus or minus 3 hours as the window of implantation. However, if your center decides to do a day 3 embryo transfer, then you can put it at 72 hours. Okay, but generally 5 days is 120 hours. Right. So who should use this MIRA testing? In my practice, if I have a patient who has failed a frozen embryo transfer once, either by me or another center outside, then I would advise them to do the MIRA. Because for me, one failure is more than enough. Because for a patient, they do not want to hear a second time that they failed. So it's always better to do certain testing for them to reassure them that we are doing something about their fertility chances. Older patients are another group, and patients with few remaining embryos. So if you have a patient with one embryo, I wouldn't want to take chances. I'd rather just transfer the embryo straight away. The other is an abnormal uterus, generally because of the presence of fibroids. Some patients, you notice, you have done surgery to remove fibroid, but sometimes certain fibroids are either difficult to remove or come back again. So we did this analysis in my centers, the headquarters in Puchong, my branches in Penang, Ipoh, Thomson Hospital, Johor Bahru in Malaysia. So we collected 179 patients in five of our centers. The ages were around 37 years of age. And the lining, all these patients underwent HRT cycles. Generally, we give Progenova 2 milligram 3 times a day. Okay, and then the womb lining was about 9 centimeters. The BMIs were around 24, and they either had an implantation failure, either one or twice. So you can see we don't wait for 3 times. So after excluding certain patients which are still waiting for results or waiting for the beta or yet to perform the transfer, and some patients even got pregnant spontaneously. Okay, so we had 151 cases. If you can see this, if you notice that the successful implantation, there were about 87 of them, and that gives us a success rate 57.6%. Okay, and the patients who were not pregnant failed were 64. So we analyzed the subgroup of patients who have failed. We checked whether or not we did PGT or not. Generally, in our centers, the number of cases that we do PGT is about, 20 to about 30% of cases that we do PGT. Okay, so but only for this particular analysis, there were only 23.8% of women who underwent PGT. So those patients who failed, only 14 of them underwent PGT, and 43 of them did not. Okay, 7 on them, we really couldn't find the nodes. Couldn't decide on whether or not they had not. So you can see most of them didn't undergo the PGT. So hence, most likely that the patients who had failed probably had um, aneuploid embryos which were not healthy and not destined for a pregnancy anyways. So let's look at the pre-receptive, receptive, and post-receptive. In patients who are pre-receptive, 63 of them eventually got pregnant. Okay, and that was about live birth. 63 of them got pre-receptive results, receptive 103, and post-receptive above 100 and, for example, 140 plus hours were about 11. Okay, so when you look at the small chart by the side, you can see that the patients which benefited were the ones which mainly had a pre-receptive um, results. So the biochemical pregnancy was like 36.4%, ongoing pregnancy 35%. So lots of them eventually benefited from it. But we have some patients who are still yet to transfer. I'd like to share certain cases with you all. These are my personal patients. I had a patient with 38 years of age, Indian ethnicity. Her BMI was 31, a little bit on the higher side. EMH was good, 15.5, and she had 5 blastocysts, all grade BG4BB. And she had a subserosal fibroid, about 3 by 4.5 centimeters, which was not um, uh, going into the, or rather not deviating the endometrial lining. So I generally do frozen embryo transfers for most of my patients. So we did a frozen embryo transfer under the HRT protocol, where I give Progenova 2 milligrams 3 times a day from day 2 onwards, and then I generally call them in for a scan between day 8 to day 12. And once the lining is above 8 mm, then I'll check the progesterone level, make sure it's suppressed, and then I'll start them on their progesterone vaginal pessaries. And exactly 120 hours later, I did an embryo transfer. The transfer was fairly easy. Everything was fine. Unfortunately, she failed. So then I convinced her to do a MIRA test. So we did exactly the same thing. Lining was good. Vaginal pessaries are given. And then I performed the MIRA after 120 hours. And then we got the results. Results came back as 144 hours. So her lining was pre-receptive. Okay, so at 144 hours, so we had to, I explained to her that most likely her embryo did not implant because of that. So what I did was I repeated her frozen embryo transfer with exactly the same protocol and transferred it at 144 hours. And then she got pregnant. Her beta HCG was 641 tension units. And I did an ultrasound scan 6 weeks later, and the fetal heart was seen. And that was a nice, happy ending. Now we had another patient, a 43-year-old lady, a history of 2 fresh cycles, 2 frozen embryo transfers. So she's been at it for years. BMI was 30.4. She only had 1 blastocyst available. Everything was normal. Her womb was fine, bloods were fine. So I told her, like, look, you have failed before, and you only got 1 embryo. So let's check out the MIRA test. So we did a biopsy for her. Similarly, I did a HRT protocol. That's my standard protocol. 2 milligrams 3 times a day from day 2, and the lining on day 14 was 7 mm. And I started her on the vaginal pessaries, and I did the MIRA about 121 hours. Then again, so we got another result, which was pre-receptive, 145 hours. So this is probably the reason why this poor lady failed in the multiple attempts previously. So what it was exactly the same thing I did again. Lining was nice. On day 13, started the vaginal pessaries, and we did a single embryo transfer at 145 hours. And what do you know? 2 weeks later, beta Hg was 1,539. At 6 weeks, fetal heart was seen. So as you can see, we have these 2 patients. Both also had problems, failed before once. Another one had failed a couple of times. So I managed to convince him to do this test, and now both are currently pregnant. So as you can see in summary, MIRA utilizes the microRNAs, a novel type of biomarker to test for endometrial receptivity. From our center, my centers and TMC fertility centers, we see that MIRA showcases its ability in identifying the window of implantation. Along with the successful identifying the window implantation, MIRA can also be useful for patients with fibroids or limited number of viable embryos, not necessarily for patients with history of repeated implantation failures. So, as I mentioned, anyone who comes into my clinic with either one frozen embryo transfer failure, I generally do this for them. Okay, or if you have only one embryo left, and then I would convince the patient to do it, because as you can see, there are many patients which actually benefited from it. Now, of course, if you can, in the ideal world, if you can do a pre-implantation genetic testing for them too, then I'm sure pregnancy rates will eventually increase. Okay, so this is where I come from, TMC Fertility Center. This is the award that we won, and this is a new center in Puchong, and everyone's welcome to visit when you can. Okay, thank you very much.